Now let us move on to the clinical part. In clinical, we will see the first case, which is the Erb's paralysis. Erb's paralysis occurs when there is injury at the Erb's point. So now Erb's point is basically at the upper trunk. I told you, point where the 6 nerves meet. This is our Erb's point. Okay, so now what might be the causes of injury? It is due to undue separation of head from shoulder. Now this might occur due to any birth injury or fall on shoulder or during anesthesia. Nerve roots involved are mainly C5 and partly C6. So you can remember this, that then muscles paralyzed are biceps brachii, brachialis, brachioradialis and deltoid. So here is a mnemonic for it. 3BD means biceps brachii, brachialis, brachioradialis and deltoid. These are the muscles that are mainly paralyzed. Then the muscles that are partly paralyzed are supraspinatus, infraspinatus and supinator. Now what is the deformity? The deformity is that the arm is adducted, it is medially rotated and the forearm is extended and pronated. This deformity is also known as policeman's tip hand, waiter's tip hand or porter's tip hand. Disability is that movement opposite to those of the deformity are lost, biceps and supinator jerks are lost. Now the second case is of the Kalamke's paralysis. Here the site of the injury is the lower trunk. Now the cause may be due to undue abduction of arm. Nerve roots involved are mainly T1 and partly C8. Muscles, intrinsic muscles of hand, ulnar flexors of wrist and fingers are going to be paralyzed. So what are the deformities? The deformity will be, there will be hyperextension at the metacarpophalangeal joint, flexion at interphalangeal joint. Basically this type of deformity is called as the claw hand. Cutaneous anesthesia along ulnar border, forearm and hand. Horner's syndrome. Ptosis. Ptosis is nothing but the drooping of eyelid. There is going to be miosis and loss of ciliospinal reflex. Vasomotor changes are going to be observed in Horner's syndrome. There will be dry and warm skin area with sensory loss. Trophic changes, nails crack easily, atrophy of the pulp of fingers. Now there is another case which is injury to the nerve of serratus anterior or the nerve of Bell. So why does this occur? The cause is sudden pressure on the shoulder. Deformity is winging of scapula. Disability is loss of pushing and punching actions, which are partly affected overhead abduction. So now because the serratus anterior is an important muscle which is required for overhead abduction, due to its paralysis, our overhead abduction will be partly affected. But overhead abduction is not only caused by serratus anterior, but also trapezius is another muscle which aids in overhead abduction. So therefore this due to the paralysis of serratus anterior, the action is only partly affected because the trapezius muscle is still intact. This was for today. Thank you.